Fibroids are abnormal growth that develop in or on a woman's uterus. Sometimes these tumors become quite large and cause severe abdominal pain and heavy periods. While in some cases the symptoms are pretty severe, there might be a few asymptomatic patients too. Cystic fibroids are benign and non-cancerous. It is very incredible that up to 80% of women have fibroids by the time they are 50, but only a few of them are actually aware of this disease. Today, we will tell you all you need to know about cystic fibroids in this video. So let's get started. What are fibroids? Cystic fibroids are a pretty common condition where some non-cancerous growths are noticed in your uterus. Fibroids are also known by the following names: leiomyomas, myomas, uterine myomas, and fibroma. Fibroids can be of various types according to their location. Intramural fibroids. Intramural fibroids are the most common type of fibroid. These types appear within the mascular walls of the uterus. Subserosal fibroids. Subserosal fibroids form on the outside of your uterus, which is called the serosa. They may grow large enough to make your womb appear bigger on one side. Pedunculated fibroids. Subserosal tumors can develop a stem, a slender base that supports the tumor. When they do, they're known as pedunculated fibroids. Submucosal fibroids. These types of tumors develop in the middle muscle layer or myometrium of your uterus. Submucosal tumors aren't as common as the other types. What causes fibroids? The exact cause of fibroids is unknown, but nonetheless, there are some factors which might influence the development of this disease in your body. Hormones. Estrogen and progesterone are steroidal hormones produced by your ovaries. They cause the uterine lining to regenerate during each menstrual cycle and may stimulate the growth of fibroids. Family history. Fibroids may run in the family. If your mother, sister, or grandmother has a history of this condition, you may develop it as well. Pregnancy. Pregnancy increases the production of estrogen and progesterone in your body. Fibroids may develop and grow rapidly while you're pregnant. Symptoms you should be aware of. The symptoms of fibroids can vary according to the size and location of these outgrowths. If your tumor is very small or you're going through menopause, you may not have any symptoms. Fibroids may shrink during and after menopause. This is because women undergoing menopause are experiencing a drop in their levels of estrogen and progesterone, hormones that stimulate fibroid growth. Symptoms of your fibroids may include heavy bleeding between or during your periods that include blood clots, pain in the pelvis or lower back, increased menstrual cramping, increased urination, pain during intercourse, menstruation that lasts longer than usual, pressure or fullness in your lower abdomen, swelling or enlargement of the abdomen. Who is at most risk? Women are at a greater risk of developing fibroids if they have one or more of the following risk factors. Pregnancy. Hormonal fluctuations during pregnancy can provoke the growth of cystic fibroids in your uterus, thus forming complications during delivery. A family history of fibroids. Researchers have not ruled out a hereditary connection to this disease, so it is best for you to consult your physician if you have someone in your family who have suffered from cystic fibroids. Age of 30 or older. Fibroids are observed to a greater percentage in women between 30 and 50 years of age. A higher body weight. Obesity can bring a lot of diseases to your body, and fibroids is one of them. If your BMI is over 30, you need to go see a doctor for further testing and diagnosis. How is it diagnosed? For a proper diagnosis, you'll need to see a gynecologist and get a pelvic exam. You may also need other tests, which include ultrasound. An ultrasound uses high-frequency sound waves to produce images of your uterus on a screen. This will allow your doctor to see its internal structure and any fibroids present. The transvaginal ultrasound, in which the ultrasound wand is inserted into the vagina, may provide clearer pictures since it's closer to the uterus during the procedure. Pelvic MRI. This in-depth imaging test produces pictures of your uterus, ovaries, and other pelvic organs. Treatment. Your doctor will develop a treatment plan based on your age, size of your fibroids, and your overall health. Certain home remedies and natural treatments can have a positive effect on fibroids, including acupuncture, yoga, massage, applying heat for cramps, avoid heat if you are experiencing heavy bleeding. Dietary changes can help as well. Avoid meats and high-calorie foods. Instead, opt for food high in flavonoids, green vegetables, green tea, and cold water fish such as tuna or salmon. Managing your stress levels and losing weight if you're overweight can also benefit women with fibroids. Medications to regulate your hormonal levels and surgery myectomy to remove multiple or severe outgrowths can be used to treat you too. The surgery can be also performed laparoscopically using few small incisions into which surgical tools and a camera are inserted. Fibroids might grow back after surgery. Fibroids are a common ailment, and you can easily subdue the symptoms with proper knowledge and some careful treatment. You have now learned about the symptoms of cystic fibrosis, and you will be able to understand if you have the disease. We hope you found this video informative and do recommend it to other friends. Thanks for watching. That's all from us today. We want you to know that your voice is important to us, so please leave a comment below. If you're new here, then click the bell icon for notifications of our new videos. For more content, visit our website www.thevoiceofwomen.com. Till the next time, stay safe and stay healthy and let your voice be heard.